Milk and kidney patient. The questions which are revolving around this area is whether a CKD patient, chronic kidney disease patient, can take milk or not. Which milk is preferred, cow or buffalo milk? The patient on dialysis can take milk or not. This is the topic for discussion today. Milk, as a very good source of nutrition, contains a good quality of protein, macronutrition and micronutrients. On an average, if we take 250 ml of milk, approximately 6 to 8 gram of high quality protein, macronutrients, micronutrients, few of which include calcium, phosphorus, potassium, vitamins, especially vitamin D, A and B complex also. Very good source of nutrient the milk is. What happened in kidney patient? To be more specific, chronic kidney disease patient. The kidney function is not in normal category, it is on the lower side. If the kidney function is on the lower side, let us take an example. If it is below 50%, if I say 50%, it means kidney eGFR might be below 50 on an average. The body's ability to handle phosphorus and potassium might not be as good as in the normal kidney. The problem is not about the nutrient value of the milk. The problem is about how we are going to give the load to the kidney in the form of phosphorus, potassium. At the end stage, probably the role of protein also comes. So what to do? As the kidney function start decreasing or deteriorating, better to restrict the quantity of milk to 250 to 200 ml, maximum 1 cup per day. Which one to prefer? There are various categories like toned milk, double toned milk. Toned milk is nothing but a cream layer is removed. Basically, the fat percentage goes down. In an untoned milk, if the fat percentage is around 6%, in the toned, double toned milk, on an average, it goes below 3%, 1.5%, like that. Basically, the lipid content or the fat content goes down. A CKD patient or the patient with the kidney issue, preferably they have to take a toned milk or a double toned milk. If they are getting directly from the vendor who sells the cow milk after taking it directly from the farm, you can just boil it, let it cool down, it forms a thick cream layer above that can be removed, after which you can add some amount of water, 100 to 200 ml of water to the milk of approximately 300 ml. It will get diluted. Again you can boil it and use it. So overall, if the quantity of the milk per day is less than 250 ml on an average, it will be better. The kidney can easily handle the load of phosphorus and potassium. Meanwhile, all the good nutrition quality of the milk will be available to the person who is suffering from the kidney issue. Suppose if the kidney function is already doing fine or good, obviously they can take a good quantity of milk. Even 2 times is not a restriction, whereas if the GFR is below 30, quantity have to be restricted, preferably a toned milk. Why toned milk? Fat content is less. Since they are at risk of cardiovascular disease, a toned milk or double toned milk won't add to the burden of lipid or fat burden to the body. So that is why preferably toned or the double toned one. Then comes the next question. A dialysis patient, are they freely allowed to take milk? The issue is about in dialysis patient if the phosphorus and the potassium is under control in the lab parameters. Serum phosphorus level and serum potassium level is under control. Keeping those two parameters, yes, milk can be taken, that also in a restricted quantity if the dialysis clearance is adequate. Suppose if the patient is on irregular dialysis or the patient is on end-stage disease where he is not on dialysis, better to avoid milk because it will add on to the load of phosphorus in the body. As the phosphorus increases, the CKD, kidney disease, some other component, vascular calcification, some problem can increase. So if a patient is on end-stage renal disease and not on regular dialysis, better to avoid it or reduce the quantity to 100 ml or dilute the milk with equivalent amount of water, that too after the removing the creamy layer. So this is related to the dialysis patient. If the person is taking thrice weekly dialysis regularly, phosphorus is under control, potassium is under control, yes, can be taken at a restricted amount. Another doubt, cow milk or buffalo milk. Considering the fat quantity, potassium and other micronutrient availability compared to the buffalo milk, cow milk can be preferred. Cow milk can be preferred as the potassium phosphorus load or the fat load can be better handled by the body, especially in a kidney patient with cow's milk. Suppose if cow milk is not available, only source is buffalo milk, just reduce the quantity more. So these are all the important details for the OPD patient who have these frequent doubts whether to take it or not. This is related to the dairy product milk. The discussion was on quantity and related issues. In summary, single line, for the kidney patient, make sure your potassium and phosphorus is under range. If it is so, then take up to 1 cup of milk, that too double toned or toned one preferably. Probably you can dilute it and take it. So this is the single line answer. Which milk? Cow milk is preferred than the buffalo milk. With respect to the other dairy products like curd, paneer or even the vegetable milk, we will see in the subsequent videos. Bye bye.